So, welcome Dr. Somshekar, a spine surgeon, for this short discussion on slip disc and sciatica. So, what these are they same or same? Two names for the same process or different?
So this is a very good question because many patients every day they come to my clinic and they ask me, sir, is this a slip disc or is this a sciatica? So basically, slip disc and sciatica is both are same, not exactly the same. I'll explain now. So the slip disc is basically there is a disc between the bones in the back. So basically, we have a 31 bones in the back. So between each bone we have a jelly-like material. It's called disc. So that is basically needed for cushioning effect of the normal movements. So whenever this disc comes out, this is called a slip disc. The disc is slipped out of its place. It's as simple as that. So it is called a slip disc. So when the disc comes out and it presses on the nerves which is passing nearby, so you will get a pain. That pain comes from back to the leg because the nerve for the leg comes from the back. Whenever the disc slips out and presses on the nerve, the pain comes from back to the leg. It is called a sciatica. So basically, sciatica is because of slip disc. So usually people get confused what is slip disc, what is sciatica. So it is because basically the sciatica is due to slip disc. It is as simple as.
So, what percentage of people with the slip disc, and this is a common practice, many people get scared. Also, slip disc, matlab, if you go to a spine surgeon, they will advise surgery. This is the fear they have commonly. So, because of this, many people avoid consultations and they keep taking some small issues. So, what percentage of people with the slip disc and need surgery, and when do we need surgery?
So, again, the good news is 90 to 95% of the slip disc doesn't need surgery. Most of the slip disc will get cured with physiotherapy, medications, lifestyle changes, and maximum injections. So, slip disc, if slip disc is a don't worry that you need surgery because majority of the slip disc can be treated without the surgery. This I am stressing out again and again because people will think that slip disc means I need surgery or this. No. So 95% to 90% can be treated without the surgery. So even if you require surgery, nowadays we are not going for open surgeries like big incisions, opening the spine and doing surgery. Nowadays we are tackling majority of the spine surgeries with a keyhole. That is through the hole we are tackling the disc. For example, if you need a discectomy, you are doing through keyhole discectomy. Like endoscopic discectomy is also on the cards now. We are doing all types of surgeries with keyhole. At least 95% we are doing with keyhole. Especially for the disc, nowadays we are doing keyhole surgeries. So no need to worry even if you are in that.
So, what is the major difference between normal spine surgery and the keyhole surgery?
So in normal spine surgery, usually the cuts will be bigger. Because of bigger cuts, patient will have a more blood loss, like the bleeding will be more. Second thing is patient will have more pain. Third thing is patient require long time to recover.
Okay.
And the most important fourth thing is they stay very long time in hospital if they go for open surgery. Okay. So with the keyhole surgery, so the blood loss is less.
Stay in the hospital
is less.
Recovery time is also less.
Recovery is very fast. So these are the major advantages of keyhole spine.
So in what percentage and what specific spine surgeries? Because now this robotics become a trend.
Yes.
People think that each and everything robotic is required.
Yeah.
So like you told about keyhole, and what's a percent surgeries like you think that robotic is compulsory? Rest all surgeries you can do without robots.
So this is for information for all the persons in Bangalore. I want to tell you that robotics in spine surgery, now it is evolved only to the stage that we usually use robotics only to put screws in the spine, pedicle screws. So rest all the things is done by us, that is through keyhole. So robot is used only for putting pedicle screws. So other things are all through keyhole surgery by us only. So this is there all over the world, it is same. Robotics is used for only for screws. Rest all can be tackled with keyhole surgery.
So like for example, suppose if you do some 10 surgeries, different surgeries, so most of the surgery doesn't need robots.
Yes.
You can do it by yourself. Yeah. Only few surgeries where this one they can involve robotics also should be involved. Because now the trend is like people think that robotic matlab every surgery has to go through robotics, but not required. It will save a lot of money. Obviously, robotics are expensive than the regular.
So people surgeries. Think that robotics is robot will come and do the surgery, but in spine surgery it is not, because robot is only used to put screws, because robot will come and land there. If you put screws, and once the screws is done, robot will go over. Rest everything is done by us in spine surgery.
See, one of the back pain, neck pain, and disc problems and all. See, in my as a general physician and diabetologist practice, I see many patients with vitamin D deficiency and people who don't take a proper protein diet. They come with a simple spasm, sprays, it doesn't go for 3 to 4 weeks. So have you come across these kind of things? Suppose, for example, typical vegetarian diet, no protein, vitamin D is chronically deficient. How they come with the neck pain, back pain, other issues?
Definitely, because one of the causes for back pain and neck pain is vitamin D deficiency. And in our practice, we regularly put the patients on vitamin D without asking, because vitamin D comes from the sunlight. And most of the us is not exposed to sunlight, because we have to expose for a longer period of sunlight if you want to get vitamin D from sunlight. So that is not possible in most of us. So we usually put a vitamin D for all the patients who have a neck pain and back pain, unless they have taken recently. So vitamin D, because even we got the blood test for many people who comes to us, most of them, I can say more than 95% are vitamin D deficient.
Somebody is having a back pain and a severe vitamin D deficiency. For such patient, instead of giving a weekly capsules or a liquid, can we give directly one shot of injection that acts as an anti-inflammatory and immediate response?
Definitely, you can take an injection. There is no harm in taking vitamin D injections. Usually, give 60,000 international units one shot. Or other option is those who don't want injection, we can give weekly capsule for 8 to 12 weeks and maintenance dose of monthly ones.
So normally people think in India, like above 45-50 years, the only exercise they give importance is walking. So apart from walking, to maintain the good health of a spine, what other exercises you recommend on a daily basis?
So walking basically will act all over the body. It is very good for general health. But if you want specifically for a spine health, for example, your neck muscles should be strong, your low back muscles should be strong, we suggest something called as strengthening exercises, called as core strengthening exercises. This is very important because by walking you get general health, not the specific muscle health. So by doing core strengthening exercises, you will strengthen your neck and low back.
So core strengthening is simply planks?
So even the plank is also core strengthening
exercises.
exercises. Lifting your pelvis up and maintaining that is a core exercises. So cycling and the by lying down is a core exercises. So these are core strengthening exercises.
So only cycling, it could be a stationary cycling at home or in a gym, or a simple plank at home. They can do it anytime. At least simple 1 minute of plank every day. It strengthens this one, and most of this is good posture.
So my most important is, once you do core strengthening exercises, your muscles on the back will get strengthened. Once your muscles is strengthened, your pressure on the spine is lessened. So the pressure on the spine will be less. So that the problems of disc, problems of aging, problems of other spine related problems reduces significantly.
Okay. Thank you for that information. If you will any further doubts, please comment in the comment section, and also we'll add a mail ID, and Dr. Somshekar is available in Manipal Hospital, Kanakpura Road. You can come and meet him and consult. Thank you.